Alrighty, so welcome to the Virtual Family Council meeting. My name is Jamie Rose. I am the Virtual Family Council Coordinator. We're going to review our confidentiality statement. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. These calls have public access and are designed for family members, friends of residents, and long-term care facilities. We'll review our meeting agenda. We are going to get our virtual meeting tips from Bernadette this evening, and then we're going to listen to a presentation on the greenhouse project, and then we'll review our upcoming meeting topics. So I'm going to turn it over to Bernadette for our virtual meeting tips.
Thank you, Jamie. So first, we would ask you that we want to tell you you've all been placed on mute upon entry, and we will open the lines in a bit so that you're all able to share. If you would like to speak or have a question, please use the raised hand feature. Once you raise your hand, we will know to acknowledge you and unmute your line. If you're not sure of where to find the raised hand, just click at the bottom of your screen under participants. A box will pop up and you'll see on the bottom right, raise hand. Just click on that. If you hover over your mouse near the bottom of your screen, you will see the participants tab. That's what I said. And it can be expanded if you would like to see that. The chat feature is at the bottom of your screen. If you have a question for the presenter, please message the chat moderator and they will ensure your question is asked. Closed captioning is available during these calls. Please find Enable Closed Captioning at the bottom of your screen if you would like to view captioning live. If you need to step away, you can stop sharing your camera by clicking on the camera icon at the bottom of the screen. You can click on it again to start sharing your camera again. Concerns or complaints can be directed to the State Ombudsman Office at 717-783-8975 or by email at ltc-ombudsman@pa.gov. And at this point, I guess I'm turning it over to Corey Hurley.
Yes, I am introducing our wonderful presenter tonight. It's Jeff Shireman. He is the president and CEO of Londonderry Village. It's a long-term care community in Lebanon County, and it, as far as I know, is our sole greenhouse project community in the entire state of Pennsylvania. So we're excited to hear what Jeff has to present tonight. Thank you. Here we go, Jeff.
Okay, thanks, Corey. We are indeed the sole greenhouse community in the Commonwealth of Pennsylvania. We've been that way. Unfortunately, we would like to have more of them. We would like to have some other colleagues do this, but so far, our first two greenhouses opened in 2007 and 2008. But just to take a step back, if we look at Londonderry Village, many of you or some of you who are familiar with Lebanon County might know our original name was the Lebanon Valley Brethren Home. That was our retirement community that was opened in 1979 as just a nursing home at that time. And over the years and decades, we've added other levels of care and particularly independent living. And so today we're a community of a little over 600 residents. 500 of them are independent living. About 75 are in various units of nursing care and 30 in personal care. Of my 88 licensed skilled nursing beds, 60 of those are in greenhouses. So that would be 6 10-bed greenhouses. And then I also have a 28-bed older unit, which is still the traditional model. But we can go to the next slide, Jamie. Okay, I arrived here in 2004, and the board of directors confronted me with the need to replace the 1979 era nursing units, which were built in the very traditional model that you see when you would go to most nursing homes. The vast majority of nursing homes in the United States were actually built in the 60s, 70s, and 80s. typically from very similar building codes across our 50 states, and largely on a hospital model in terms of how they're constructed. They are classic institutions for most of them in the sense that, just like prisons, hospitals, sometimes convents, the folks who live in these institutions have traditionally had very few choices about how their day was organized and what they could do and not do. And so we wanted to change all that, but really didn't know how to go about changing the model. Like most facilities built in that era, most of our rooms were semi-private, which I think is sort of an oxymoron. You can either be private or not private, but I'm not sure exactly what semi-privacy is. And like everything else, they were built on a model that was seen as being efficient, but not really a good place to live. Okay, you can advance to the next slide. So in the beginning, there was the nursing station. You'll see that in most of the nursing homes that you go to. It's a real fixture. I talked to an architect once who told me that the design actually of the nurses station and how units are organized actually dates back to Civil War field hospitals, where the idea was to get as many injured soldiers around a centrally located area where the doctors and nurses were. And as tents became hospitals and walls and buildings, that same concept was followed. And so it was all again about efficiency. You can see in this picture, and this is going back from our history 20, 30 years, like most other nursing stations, very high counter. So we demarcate the nursing space from the resident space. So it's very clear who's in charge here. And again, that's something that the greenhouse model is trying to do away with. Okay, next slide. The first greenhouse actually opened in 2004 in Tupelo, Mississippi. It was the vision of Dr. William Thomas, who's a very well-known geriatrician in the field, has written several books on elder care topics. Some of you might recognize the Eden alternative. That was his concept as well back from the 1990s. And in the greenhouses, what he said to basically he and the CEO of a Mississippi Senior Services in Tupelo, Mississippi, they said, we want to do something different. We want to reimagine nursing care. We want the concepts that we love about Eden alternative and culture change, but we want to do it in a different type of physical environment. But they realized they had to do it also in a way that met all of the state and federal regulations for nursing homes. And so my green homes and all of the 300 plus greenhouses across the United States all meet the state and federal regulations that govern nursing home care. It is very much a difference in terms of it's a social model of care versus the medical model, which means that the doctors and nurses are not center stage anymore, but the folks who actually work with the elders every day, in our case, Shabazz, and I'll go into that a little bit more. But it is based on relationships and small home concepts. We feel that, if you go to most nursing homes, they're typically 40 to 60 elders or patients or residents on a unit. We feel in the greenhouse movement that is way too many, and it actually inhibits the development of good personal relationships. Okay, next slide. Just some shots from Tupelo when I went there to look at the first greenhouses. I can see very residential model. Our patios are in the back, none in the front. In terms of how this one was organized. One of the things you see there in the top picture is the Shabazz, is the lady in the middle. She actually eats. She not only cooks the food for the elders in that house, but she eats with them and stimulates the conversation around the table and assists people who need it. The lady sunglasses was somebody I met while I was there. She is legally blind, but she told me what a beautiful room she had, and she showed me all of the niceties in her room and all her personal possessions. Next slide. This is a picture of Dr. Bill Thomas. He is sort of a Renaissance man and sort of a rock star in the long-term care world, and he's had several major ideas. In the Eden alternative, which he pioneered back in the 1990s as a young Harvard-trained physician, recently out of school and working as a medical director at a nursing home in upstate New York. And he theorized that what's wrong with people in nursing homes is not the fact that they were old or that they had several diagnoses, but that they were lonely, they were bored, and they were helpless. And he termed these the three plagues of elderhood. And his culture change movements, first to Eden Alternative and now the greenhouses, have really attacked this in terms of promoting quality of life. It's shown here one of my residents on the campus. He came to our groundbreaking, and she actually had a book for him to sign. Next slide. These are my Shabazim, they were the original Shabazim that were trained. A Shabazim is by prerequisite, a certified nursing assistant, but we taught them over a couple of week period to cook for the residents in their care, as well as to do light housekeeping and some house management, other types of things. Dr. Thomas theorized that in the United States, the term nursing assistant, nurse's aide, what have you, has a negative connotation among many people, and he wanted to come up with the term for a universal worker who did a lot more than that and held a much more responsible position, and Shabazz is what he came up with. Shabazim, if you know your Persian, is the plural, but it actually dates back to a Persian mythology about a royal hawk who was responsible to protect, nurture, and sustain the inhabitants of the valley below its nest, and that is the role of the Shabazz, to protect, nurture, and sustain the elders in their care in the homes where they serve. Next. Just a view, you can see how residential, actually this does not look anything like a typical nursing home. And when you walk in, it doesn't look, smell, feel, or any other way resemble what you would typically feel when you walked into most nursing homes. Next slide. So there's three key concepts that actually make the greenhouses work. These were developed by the National Greenhouse Project. We'll go into each one of the three in more detail. The first would be real home on the next slide. And this is, we'll go to the next slide, please. You know, really what makes the difference, what makes a house a home, I guess you would say. And in this case, there are several things that really make the greenhouses work. First, there's a maximum number of folks. By the greenhouse guidelines, you can have no more than 12, but actually most greenhouses have 10 or fewer. All 6 of my greenhouses on our campus have 10 beds. We feel that's about perfect, as we have seen it. All food must be cooked in the house where the residents can see it and smell it and experience that. We find in most nursing homes, the food is cooked 3 floors away in the basement and brought up on an elevator or in another part of the building. And the residents who live there actually have no idea that it's time to eat because they've never been cued in their brains to the fact that it's smelling good and it's time to actually sit down and chow down. In greenhouses, again, trying to create all private rooms and baths, that is a requirement to call yourself a greenhouse, which is a copyrighted term. There's an open concept. The kitchen, the living room, and the dining room are all very open to each other. They're in the center of the house. The 10 bedrooms are around the perimeter of the house. That actually is not only makes it feel more home-like, but it also enables the staffing pattern, because one of the Shabazim can be cooking in the kitchen and keeping an eye on the residents who are in the living room or dining room area. At the same time, the other Shabazim, because there's 2 on day shift, 2 on evening shift, and 1 at night shift. So during the 2 main shifts, the one person in the kitchen can actually keep an eye on the residents while the other one goes door to door and does whatever care might be required inside that room. Unlike most nursing homes where you can, whether you're a volunteer, a staff member, a family member, what have you, under non-pandemic times, you can just usually walk onto the units. You can't do that in a greenhouse. Like your house and my house, you have to ring the doorbell and be welcomed into the house. So that sets the tone right from the very beginning that this is not an institution. This is where somebody lives. It's their home. All greenhouses, again, by design requirement, must have a fireplace. It doesn't have to be a working fireplace. Ours are. But we feel this is a very powerful symbol of home and is well recognized and appreciated by the folks living in that house. There's one 14-foot long dining table. And so all 10 elders, as well as the 2 Shabazim, are seated around that table for the 2 main meals of the day. And it is there's a lot of life that happens around the table, let's put it that way. Accessible outdoor spaces. One of the things I find when I go to most nursing homes is that the residents who live there can't actually go outside without either asking permission or getting a staff member to take them out through secure doorways. And our greenhouses, as all others, There are accessible outdoor spaces that the residents can get out to during the nice weather, and they don't have to ask anybody's permission. In fact, one of the neat things that I've seen is in the summer, breakfast is often served on the veranda, and then the Shabazim brings out the newspaper and they go through Dear Abby for the day and find out and talk about the cheating husbands and everything else. And it's quite a time. Okay, next slide. Empowered staff. As I mentioned, the Shabazim are CNAs on steroids. They do a whole lot. They are in charge. There is no administrator or director of nursing that is in the house on a regular basis. Those folks do float through to make sure everything's working well, but we trust and empower the Shabazim to actually be sort of like house mothers, I guess you could say. There are nurses that come in and out of a greenhouse. They do the treatments and obviously deliver the prescriptions and administer those, but they are not the bosses of the Shabazim. They do not supervise these two workers. Actually act as colleagues, not in teammates. There's not a boss supervisor relationship. There is a guide there's one guide for all of our 6 houses whose job is to help facilitate and to resolve conflicts, but not to micromanage. And so that person is by design not in every house all day long. Consistent staffing, very important concept in the greenhouses. Most of the staff work in one house and one house alone. I have one house that's been open for a dozen years now, and some of the staff are the same ones that started on day one. There are a few folks that are trained to go from one to more than one house if we need to fill in, but for the most part, you stay in one staff. What that does is that it allows those staff to really get to know the residents in their care. We refer to them as elders, not residents. And there's this concept of deep knowing, something Dr. Thomas coined that term. What that refers to, and anybody who's ever raised a 2-year-old would probably readily recognize this. When the 2-year-old starts to grip their crotch, you know they have to go to the bathroom because you've been around them for their whole 2 years and you know their signs. A Shabazim in a greenhouse, they know their residents so well that they can anticipate their needs. Who needs to go to the bathroom, who's hungry, who needs to drink water, who's not doing well. One of the things that our physicians tell us is they get earlier and quicker information from our Shabazim in greenhouses than they do in other medical units. And so if somebody is perhaps brewing a urinary tract infection and they're slightly confused, the Shabazim immediately recognize that person is off their baseline. That's not who they typically present as. And they can inform the nurses and physicians that we need to look into this. The elders in the Shabazim that live and work in one of the houses, they are a team. And so they jointly govern. There are team meetings between the groups. They make decisions. There are some of the earlier decisions about what should the Shabazim wear. Should they wear scrubs? Should they wear street clothes? Things like that. Should the house have pets? Should they not have pets? Upcoming activities. So it's a joint responsibility for governance. And the staffing pattern I mentioned before, there's 2 Shabazim on days and evenings, 1 at night, and then there's 1 LPN that basically goes from one greenhouse to another, spending approximately 4 hours per 8-hour shift in each of the 2 houses. And that staffing pattern, if you would multiply it out, equates to 5.2 nursing hours of care per day per resident, which is the state minimum, as you probably know, is 2.7. So well above what is required, well above what you would typically see in most nursing homes, which tend to staff somewhere between 3 and 4 hours per day. Next slide. Meaningful engagement. Again, what makes this different from an institution? Elders have choices about their daily routines. So there's no set waking times. Breakfast basically happens when you wake up. Why should we compel somebody who for the first 80 years of their life never ate breakfast? It was not their thing. And now if just because they're in a nursing home, we typically get them up in a traditional nursing home at 6 or 7 in the morning because breakfast trays are coming. That doesn't happen in a greenhouse. If you want it, the food's there. If you don't want it, sleep in. There's no rigid calendar of activities. Most of us don't have an activity calendar on our refrigerator in our homes. And so activities tend to be more spontaneous. There are things that do happen, but it's not like everybody has to do the same thing at the same time. Families and visitors are part of the household. I actually was a family member for a little less than 2 years. My mother-in-law was in one of my greenhouses. You cannot visit a greenhouse resident by yourself or by themselves because you are visiting the household. When you're in the living room, everybody else comes over because they want to be part of the conversation and the visitation. And it feels, our family members say that it feels so much different than a traditional nursing home. And they get so much closer, not only to their loved one, but also to the other folks that are in the household. I mentioned before, you can go outside when you feel like it. You can bring pets in either as permanent residents of the greenhouse. It doesn't happen all that often because usually residents don't vote for that. One of the things that's really interesting is our Shabazz, without us telling them, or they came up with this new concept, birthday dinners. When it's your birthday, you get to pick the meal and the cake. You would think many of them would be ordering, prime rib and lobster, and that does sometimes happen. It's not only for them; it's basically everybody eats the special food for that night. What do they really want? Junk food, Chinese, Burger King, pizza, stuff that they typically can't have access to when they're inside of a medical facility. Next slide, please. Okay, just a view. I mentioned the open concept. You can see the kitchen, how open it is. You can see the person there standing over by the appliances. Next slide. That's I told you they have fireplaces, hearth. This one was decorated for Christmas at the time. One of the neatest things I saw in one of our greenhouses, again, completely originated as an idea by the Shabazim. They asked all the families to bring in wedding pictures of the residents from their original weddings, almost all black and white, obviously, from going back to the 30s and 40s, and made for a Valentine's Day that was extremely special for everybody. Okay. Next slide. Convivium, that's Dr. Thomas coined that term. It's from the Latin convivio. It basically means the life around the table. Best thought of is when traditionally, not during the pandemic, most of us, when we gather for that big family Thanksgiving dinner, and there's stories that are told and jokes that are told and just good times being shared by everybody. This is what we're trying to create at the table, the single table on every occasion. And what you find is that even after the meal is over, people linger at the table and they socialize, and there's Bible studies that go on there, and some ladies get their nails done, and it's just a real nice place for socializing. One of my favorite stories about the greenhouses, I was in one day and I approached a resident, an elder in the greenhouse. She was alone at the table. She had got up late. She was pushing around some eggs, and she was somebody I knew to have fairly severe dementia. And so I knew she wouldn't know who I was as the president of the organization. But as I approached her, she pulled out the chair next to her and she said, "Come, sit next to me. They'll bring you anything you want." She knew even through the haze of dementia, this is where you get your needs met. This is where the best food happens. And as I will tell you in a few seconds, these places are extremely dementia friendly. Next slide. All private rooms. You can see on the windowsill all the personal possessions. Everybody has a private room. Everybody has a full private bath. That includes a shower, and that's integrated within the bathroom. And they can paint. We have different colored walls and all that type of stuff. We generally do not allow folks to have their own beds because there's still these ancient federal regulations that say the beds have to have wheels on them, because in the event of a fire, we might have to evacuate that resident in the bed through their doorway, and so they have to have wheels on it. In actuality, nobody in their right mind would evacuate that way because probably everybody would die. It would take so long, and so folks would be evacuated in either wheelchairs or blanket drags in a true emergency. But because of that rule, we cannot allow our residents to have their beds that they've been sleeping in for decades, and they have to have sort of the more medical beds that have the wheels on them. Next slide. Very dementia friendly. What makes them dementia friendly? They're small. The patient density is such that there's not a lot of people in your space, so catastrophic reactions are rare. They're also extremely quiet. There are no audible call bells. So when a resident does ring a call bell, it goes to a beeper that the Shabazz carries on their hip. And so you don't hear the clang, clang, or beep, beep, whatever in the house that alerts people to the fact that there's a call bell going off. we find that the fact that everything in the imagery of the house feels and looks like a house, that people just are much more comfortable. And we have seen people who have been on a whole range of psychoactive medications that really cut those down to hardly anything within a couple of weeks of being in a greenhouse. Doesn't happen for everybody, but I have seen it. People have been very combative who no longer are. Next slide. I like this picture. We'd had this during a photo shoot, but the one thing that it illustrates, I mentioned before about visitation, is the family is on the far side of the table there with their loved one sort of in the middle. They're visiting a little after lunchtime, but there's other people at the table who they all well know because of the multiple visits to the house. But the thing that's really striking, and how many times would you ever see this in a true nursing home, the woman standing up in sort of the gray sweater in the middle of the picture, she's actually in the kitchen washing dishes. She volunteered. She asked the Shabazz if it was okay with them if she washed some of the dishes while they continued to converse and socialize. And that's just something you would not find in a traditional nursing home. Okay, next slide. So one of the things that has attracted a lot of media attention in the last several months, been featured in several magazines like Atlantic Magazine. And I know our greenhouse has actually been talked about years ago in the Baltimore Sun, the Washington Post, New York Times, Wall Street Journal, because it is a novel type of concept. There are 300 greenhouses, but what has made them? The track record has been such that the number of COVID cases as well as the number of COVID deaths have been a fraction of what you would find in traditional nursing homes. And obviously there's a lot of research ongoing right now to determine what has contributed to that. And my best guesses, which I am pretty sure will be borne out when the research comes in, are on the next slide. And they pretty much are what you would expect. Next slide, please. The small buildings help with containment. You only have 10 elders in one house. You don't have, if you look at here in Pennsylvania, the facilities that have had significant outbreaks, it has been the facilities that have 150, 300, beds in their facilities. Many of them former or current county homes where they have, in some cases, 3 or 4 people still in a room. And all of those things really make it hard to contain any viral outbreak. So we have small buildings, only 10 people. We have private rooms and private bathrooms. Again, it makes it much easier, even if one resident were to be infected. It's literally easy to isolate them. Consistent staffing. I mentioned about the fact we don't share staff. There was a study done several months ago looking at some of the nursing homes that had some of the worst outbreaks in the United States. What they found, and they used they tracked cell phone usage and data to find out that in many of these nursing homes, their staff worked in 2 facilities. And so if they got something in one facility, it was basically brought into the other facility. At our campus, we have actually, early on, we told our staff we would not allow them to work in another facility during the pandemic. And those folks that did have other jobs actually shifted to ours and picked up more hours at our place and stopped working at their second job. But with the consistent staffing, we're not bringing different people into the greenhouses to bring whatever bugs might be there. We very rarely, I can't even remember the last time we used an agency staff person in a greenhouse because the agency folks would just have no idea the conceptual basis of how we operate those. And there's also a greater sense of community responsibility when not only the families and the staff members, they grow very close to the elders in a greenhouse. One of the things we very frequently see is that when an elder in a greenhouse passes away, the sense of grief is much more profound than on a traditional nursing unit because everybody has just gotten much closer in a family-like setting. Okay, next slide. So they told me 20 or so minutes, and I've actually given presentations that have gone 2 or 3 hours on this, but that's it in a nutshell. Does anybody have any questions for me?
I don't have a question. I have a comment. I'm back in school right now to finish my bachelor's, and one of the classes that we've been studying is on gerontology, and we've been talking about the greenhouses and such. And as you are probably well aware that this generation that's coming up right now, the baby boomers from 1946 to 1964 is going to be the largest retirement group of people coming up here in the near future. And we do not have enough places for them to reside in when it's time for them to either go into a nursing home or a green home. And I'm so grateful for people like yourself that are doing this. I think it's a wonderful alternative for people if they cannot get into a skilled facility, or they need more home-like experience for them. It's a wonderful situation of what you're doing. I would really like to see more green homes developed throughout Lancaster County. That's my goal.
I would love to see that myself. There is a fallacy there that I just wanted to address. The rates of occupancy in nursing homes across the country have actually been dropping almost every year for 15 years or so, and which goes against the intuitive nature of we're getting older as a society and the baby boomers are starting to show up. People are doing other things besides going into nursing homes. They're going to assisted living facilities, personal care homes. They're having home care providers come into their homes so that they can stay out of nursing homes. They're coming into nursing homes later in the process to, and which cuts down on the number of bed days nursing homes are occupied. So there actually is enough capacity in the system. What there is not is there are not these culture change models like the greenhouses where you can get this type of care. Most of the nursing homes in the country are still the institutional, designed from that medical model built in the 70s and 80s and what have you.
Maybe you can put your email attached to this, and I'll be glad to share some research with you that I did recently on it.
Yeah, my email is very simple. It's a first initial, last name, J. Shireman at londonderryvillage.org.
Jeff, I'm Jeannie, and I'm the chat moderator. There are a number of comments and questions in the chat. Would you like to take them now, or do we still have a hand?
There is one hand up. Chris F. does have his hand up to ask a question.
Okay, let's go with Chris then.
I'll probably have to rename myself Christine. So anyway, thank you for your presentation and your enthusiasm. Well, how does the cost of care compare to a more traditional setting?
When we opened our greenhouses, we promised our residents here on the campus that a greenhouse room, which are private rooms, would not be any more expensive than the private rooms we already had in our traditional units. So there's been no additional cost for that. That being said, nursing care is expensive. It's extremely labor intensive. And particularly during the pandemic, the supply and demand curve for nurses and nursing assistants is off the chart. We are seeing nurses that are getting $50 to $70 an hour that were only making $30 an hour before that. So the costs have gone up. It is not inexpensive. It is in the $400 per day range. The one thing that I know, we had some folks from the federal government come through one time. We are, Londonderry Village is a nonprofit church-related community. They were amazed that we had folks on Medicaid in greenhouse private rooms. And that's just who we are. At this point, all 88 beds that I have on my campus are all private rooms. So everybody, whether they have money or don't have money, is in a private room. And so we feel very positive about that. A greenhouse is not inexpensive to build. The two ones that we just opened within the past year were over, they were over $3 million each, about $3.5 million per house to build. So not inexpensive. But our board is committed to the concept. We have gotten very good feedback over the years from our residents and their family members about the greenhouses, and we're 100% in, all in.
The first question that I have is from Lisa. She asked if greenhouses are licensed as skilled nursing facilities, or if they are also assisted living residences or personal care homes.
The vast majority of greenhouses in the United States are skilled nursing. All 6 of my houses are licensed as skilled nursing. There are, depending on state regulations, there are some, particularly in the state of Arkansas, there are a number of greenhouses there that are licensed as assisted living. But the state of Arkansas actually did something several years ago that was exceptional. They, in their state legislature, they not only reimburse for Medicaid for those who don't have money in assisted living in a greenhouse, but they actually established a higher daily reimbursement rate for greenhouses than for other facilities because they recognize the higher degree of quality care. So every state's a little bit different, but ours are are licensed as a nursing homes. They are part of our general license on the campus for 88 beds.
Thank you. The next question is in reference to the central kitchen. You mentioned that the Shabazine do the cooking, but the question that they ask is, are the residents able to use the kitchen if they choose, like to make a cup of tea? I have been in a greenhouse myself in Rochester, New York, and seen them in a group activity there, Jeff, with the residents cooking with their own recipes and interacting, but I did not know if they're able to do the.
Yeah, there's nothing in the regulations that preclude that as long as the resident is, judged to be safe in handling that type of, whether it's chopping with knives or putting things in a hot oven.
Right, and it would be as part of their care plan whether they would be able to.
Yeah.
So
one of the things that brought me a lot of pleasure a lot of years ago, I had several years ago, I had a daughter who came to me and she said, my mother was in another skilled nursing facility for 5 years, and one of the things we couldn't do in that setting was one of our favorite activities, which was to make Christmas cookies together. And she said, since she's in this greenhouse and we have one countertop area in the kitchen that's actually lowered so that a resident could, even in a wheelchair, could do things on the countertop. And now her mother and her can make Christmas cookies together and mix the dough and cut them out and all that type of thing. And simple thing, but it was something that meant a lot to them.
Thank you. The next question. One of the callers, one of our participants tonight, said that it was that the facility looks very similar to a place where her mother was. And then when she was no longer able to walk, she was told that she needed to leave. I saw many, many people with wheelchairs, and because it's a skilled nursing facility, they wouldn't be asked to leave. Is that correct?
That's correct. Likely the facility where you have to be transferred once you're non-ambulatory is more of a personal care facility. Skilled nursing facilities, whether they're greenhouses or non-greenhouses, you're going to find a lot of folks in wheelchairs. That's just sort of the nature of the clients. Yes, we have lots of folks in wheelchairs.
I answered a question that came from Christine F. Why there is only one greenhouse in Pennsylvania. It's a fairly new. It's an expensive concept to get off the ground.
Well, it's one of the things the National Greenhouse Project has been trying to overcome some of those fallacies and beliefs. If you look at building costs, it's really per bed, it's not very different than going out and building another nursing home, in a more modern setting where you're going to build another 30, 40 bed unit or what have you, or 50 bed. Per bed, it's actually not that much different. My personal belief is a lot of long-term care operators are very conservative. They don't believe that a 10-bed facility can make it financially because you don't have the perceived economies of scale. What they don't realize is that when you go from a traditional nursing home to a greenhouse, as I mentioned before, the Shabazz are doing a lot of the cleaning and cooking, so you don't have to employ as many dietary aides, as many housekeepers. They do some of the activity leadership, but not all of it. But there are some trade-offs. You're also not heating and air conditioning miles and miles of hallway and common spaces. So there are some cost savings associated with greenhouses that we feel they are just as financially viable as any other type of nursing home. But a lot of folks in long-term care don't believe that. And that's a sort of a mental block, and that would be my opinion anyway.
Okay. Do we have any, Corey, do we have any, or I'm sorry, who's doing the hands? Do we have any more hands on Liza?
No, no more hands as of right now.
Okay, I have a lot of questions still in the chat. One that you partially explained was the payment structure about accepting medical assistance for nursing home residents or SSI for personal care residents.
Yes, we have Medicare, private pay, and Medicaid, and also some Medicare Advantage, just like any other nursing home.
Okay. And can residents age in place?
Well, usually by the time you hit skilled nursing, unless you need hospitalization, that is going to be your last home. We do have folks adapt, and we've had folks that have stayed in a greenhouse, some of them 8-10 years. And obviously their conditions change over that time. We had one elder years ago that actually was a complete tube feed, and we still brought her out to the dining room table so that she could enjoy the socialization of being around the table, the convivium that I talked before, even though she wasn't eating per se the food orally, but she still got the benefit of what was going on socializing with her fellow housemates.
Could we address how the activities work, Jeff?
Activities are, like I say, they're more spontaneous, but there are things that are, we do have some of our activities staff that go into and lead. We find as the residents do age in place, they need more help with that type of thing. But we're looking at more individuals instead of, one of the things that most nursing home families, residents, whatever, is they always look at activities and they look at going into a room with 40 other people to bat the ball around or do something. Those large group activities were essentially a facsimile of large nursing homes. You had to find a way to efficiently engage people and get past the time. In a greenhouse with only 10 folks, you don't have to do that. You might have a group of 2 or 3 that are reading a book, or 2 or 3 or 5 that are doing some exercises with the Shabazim. Some that are getting their nails done, some that are going outside for just to sit in the sun. And so it's more spontaneous, and you can make your own choices about what you're going to do and when you're going to do it.
A question from Allie. She said, for 10 residents, how many aides and nurses are staffed for each shift? I believe you said that the Shabazine are CNAs and on steroids, that there are 2 per shift except at night.
Right, there's
when
one.
there's 1.
So if you look at that 5 individuals over a 24 period, that's 40 hours of care. That's 8-hour shifts. That's 5 right there. Then you add the 8 hours that are coming from the LPNs on days and evenings. So now you're up to 48, and then there's 4 hours from the night shift LPN. Now you're at 52. So you divide that 52 by the 10 residents, and that's how you arrive at the 5.2 nursing hours per patient day.
And I believe you said that the RNs, the nurses, and the LPNs are part of the team with the Shabazine.
Right. One of the stories I like to tell is years ago I gave a tour, and at the end of the tour I got a question. They said, "Well, I saw 3 Shabazim. You told me there were only 2. And I asked them to describe who they saw. And the 3rd Shabazim they saw was actually an LPN. They thought she was a Shabazim because she was running the vacuum cleaner. And nobody had ever seen a nurse run a vacuum cleaner in a nursing home. And it was because she's part of the team. She not only ran the vacuum cleaner, she asked the Shabazim, she said, I'm done with my medications. Is it all right if I run the vacuum cleaner? And so very different from the hierarchy that you would find in most nursing homes where a nurse would typically not go down to that level of running the vacuum cleaner for the aides.
I'm caught up. If there are any questions, Eliza, from hands?
No more hands as of right now.
Everybody is saying, Jeff, let me tell you that your presentation was wonderful, that they love the concept, that they wish that their loved one was in your facility as well. And they had the option to use a greenhouse.
Yeah, my wife is always telling me I need to advertise more, but I run about 99% occupancy in the greenhouses, just based on my own campus. So it wouldn't really do us any good to advertise because I don't have the capacity. I really wish other providers would build greenhouses. I would welcome that.
Corey, I'll turn it back to you then.
Oh, I did notice a last question here in the chat in regards to behavioral issues. Have you had to discharge a resident to a different setting because of behavioral concerns?
There have been a few over the years that have had to go out to a geropsych unit for combative issues. They were out for a week or 2 weeks and then came back to the greenhouses after the medication regime was essentially regulated so that they would be. We did have an interesting situation years ago where we had a resident admitted to a greenhouse who was sort of what we would call the queen bee mentality. She wanted to be in charge. She loved to promulgate all the gossip in the house. She wanted all the attention. And she pressed the call bell so many times per day that the other 9 residents of the greenhouse actually took offense at the large amount of attention that she was getting. And they essentially did what a lot of folks would do at the dinner table. They ostracized her, wouldn't talk to her. And so after a couple of weeks of this, she actually asked to go back to the other unit because nobody was being nice to her, but she had actually brought it on brought it on herself. But that's really that's one of the rarest cases that we've had of typically somebody who comes to greenhouse, they don't want to go anywhere else.
Jeff, your email address was Shireman at Londonderry
Village.org.
Let me type it in there.
All right, I don't see any other hands up or questions coming into the chat. So thank you so much, Jeff, for joining us this evening. It was an amazing presentation. Lots of great questions from everyone.
On your email address there, you forgot the A in Village.
I did. I forgot the A.
So it won't go anywhere.
Sorry. I was typing so fast there.
Anyway, I appreciate the invitation. I will go anywhere to talk about greenhouses. So this has been a good opportunity for me as well. Thank you.
There's
Great
the
concept. Good job, Jeannie. You got it. So if anybody wants to email Jeff, use the second one, please. So we're just going to review our upcoming topics. As you can see, our next meeting is going to be January 26th. We are still confirming a speaker for that one. And then believe it or not, we're already into February. On the 9th, we're going to have the Center for Loss and Bereavement is going to do a presentation for us. And then our last call went so well with the peer perspective, we're going to bring them back at the end of February. So I post up on the Facebook page if anybody would like to ask the residents, and we're going to have a new panel. of residents that are going to be available for your questions. So you can always send those to us via email, or, you know, on when Jay sends out the reminders, you can always send to that email address as well. Any questions you might have for the peers that we can consider for their next call at the end of February. And as always, thank you so much for joining our call. If you have any specific questions or concerns, contact the state office at 717-783-8975, or you can shoot us an email at ltc-ombudsman@pa.gov. All righty, everybody have a great evening.
Thank you.